Hello, this is your Louisiana chiropractor, Dr. Eric Prather, coming to you from Lafayette, Louisiana, Prather Chiropractic Services. Today we have Sherry with us, and Sherry's been adjusted 2 or 3 times. This is your fourth. Yeah, this is your 4th adjustment. Came in with chief complaints of neck pain, cervical pain going up and down the spine. We did some X-rays. We looked at her MRIs and imaging from prior treatments, and we discovered that Sherry has a condition in her spine called cervical stenosis up in the neck, degenerative cervical stenosis, where the spinal canal that the spinal cord passes through has gotten narrow through degenerative changes. And we usually see that in those who have a pretty extensive history of trauma to the spine. So when we were doing her history and asking some questions, we found out that, tell me a little bit more about the treatments you had prior, the interventions that you had prior.
Okay, I had 3 different steroid shots,
Okay.
about a couple months apart, maybe 3 months apart. Didn't do anything.
No.
Didn't help at all.
And these were epidural in nature, they went into the spinal cord.
Yes. And I also had physical therapy
Physical therapy,
and
results, outcome, nothing?
nothing.
Okay. Still in pain,
Yep.
conditioning, continuing to deteriorate, continuing to get worse.
Mhm.
Recommendations for surgery?
Yes, that was the next step.
That was the next step.
Mhm.
And you saw a neurosurgeon, I'm sure?
No, not yet.
It
That
was-
was the next step.
That was the pain management doctor told you that did the injection?
Yes, gave me the name of the doctor.
Yeah.
We had the appointment ready to go, and I
Okay.
thought I'd try this first.
So, and you had chiropractic care in the past too?
Somewhat.
If you call it
somewhat.
that, right?
wasn't
You went
as
to a
extensive.
chiropractor?
Yes,
Okay.
yes.
So, when you got to me, what was your pain at the first day? Like overall, level 1 to 10, where were you?
I would say 7 or 8.
7 or 8.
Mhm.
So that's high up.
Mhm.
We try to gauge a person's symptoms on a scale of 0 to 10, with 10 being burned alive, that level of pain, 0 being no pain at all. Sherry was at a 7 or an 8. So you've had 3 adjustments. We've done 3 decompressions and 3 procedures. Where are we at today?
I would say 2 or 3.
That's pretty good. All
Yeah.
right. That's pretty good. So more relief than the PT,
Absolutely.
more relief than the steroid injections,
Yes.
of course, which basically did nothing.
Did nothing.
So once we looked at your X-rays and we determined what was wrong, okay, that these joints here are the ones that are moving wrong and degenerating. We then come in with chiropractic care, properly done chiropractic care, to try to restore movement to those joints and get them functional again. That gets the inflammation out of the joint, gets the pressure out of the joint. It gets the pressure off of those delicate nerve structures in and around that joint space. And guess what? Pain starts to decrease. Now, long term, we'll have to see. We'll have to see what's gonna happen over the course of a few months. I do think you're gonna continue to improve if we stay the course. You've had great success so far. I don't see any reason why that shouldn't continue. But the body is dynamic, things change, conditions change, new things happen. But I think if we complete your treatment plan and then you maintain this at some frequency, you'll still be improving like months from now. You'll still be getting better. What I've noticed with a lot of cases like yours that are really severe at the onset, they come in, person's in a lot of pain. We can get 75, 80% improvement fairly quickly. That last 20% takes a little bit longer, sometimes a little bit, not true for everybody, but it's dealing with that underlying nature of those joints,
Right.
that degeneration. So we have to retrain those joints to adopt this new motion and new functionality. And they can be a little hard-headed, they can be a little stubborn.
I'm hopeful though.
Yeah.
I'm optimistic for
Yeah.
the first time.
Good, that's great. Well, that's good. Well, you got any questions for me about anything, about what we're gonna do today, or? You kinda
No,
know
let's
what's
just
coming.
do it.
Yeah,
I know
let's
what's
just-
coming.
let's just- Well, we're gonna start today with the decompression, and then we'll finish it up on the biophysics table, okay? All right. Let's go ahead and go face up right here, head right here, sit right here. Go. Nope. Oh, wait. There we go. Got it. Slide you down. A little bit more. All right. Let those legs relax. Put that spine in neutral. Okay, hands on the tummy. Now we're going to pin the sides in. Very good. Tight squeeze. Oh yeah. Catch your breath. Lift the head for me a little bit. Okay, breathe through that nose. Keep those back teeth touching. That's it. Big breath in for me. Move that right.
Oh, God.
Breathe, breathe, breathe. Breathe, breathe, breathe. It's a pretty good release there.
That felt amazing.
So, just lightens the load, doesn't it?
Amazing.
Yeah. You have so much compressive stress in that neck.
Mm-hmm.
You know, that's where that's the root of all that pain that you're experiencing, and this just knocks it off of there. So. there you
Now,
go.
what is a good amount? How often should I be doing this, basically?
Well, we're doing 1 to 2 times a week.
Okay.
And we're going to do that till I see 80% improvement. That's kind of my litmus test.
Okay.
That if you can stay consistently at a 2 or under
Mm-hmm.
on the pain scale, it's a little bit subjective, but we're going to feel also that decompression procedure clear out, less and less. There'll be less scar tissue to kind of break through when we do the procedure.
So, are you finding it less difficult to adjust me now than the first time?
Absolutely,
Okay.
absolutely.
All
There's
right.
less release there, and that's expected.
Okay.
There's just less compression stress in that spine. So, all right, let's finish up with that neck. See, that was the easiest movement we've gotten
Oh!
so far. Great. You did good. You did good. Good, good.
Okay.
All right, man.
Woo!
Let's go face down right
Makes
here.
me feel a little drunk.
Yeah. It's a lot of stimulation into the old pecan.
That was me yesterday.
Yeah. Okay. Let's check. She's even. Let these knees bend. Even stays even. Very good. Just release all that pressure in the spine. Very good. Okay, we're working that curve in the neck. Lordosis. Okay, roll it on over for me, ma'am.
It puts me in a daze.
And hands on the tummy. And for the head piece kick down. Bringing the head back over the shoulders here. Okay, arms outstretched. Okay, hands on the tummy. Good one. Should have felt that go into the hip too.
I did.
There
Ah!
we go. Right on. Okay. Let that arm down, go for me. Good. A little crunchy in here today. I'm gonna smooth that out. There, we got it. So far, so good?
You don't have to do my hands. But you can if you want. Ah!
Good, 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 good.
Mm.
All right, let's have a seat right here. We're gonna finish clearing out that upper circle. Okay, go ahead and sit back one. The Atlas is tracking good today. A little bit of fixation on the left. It fold over. Loosely, let it flop to the left.
Oh!
Good.
Ah!
You did good.
Ah!
Good, that's it. All right, you good? Questions for me? Questions for me? Progress.
No, I feel progress.
Okay. Right on.
Thank you.
Okay.
Awesome.
This is Louisiana chiropractor, Dr. Eric Prather. We'll see you soon.